Welcome back, and we have board-certified gynecologist Dr. Sherry Thomas here, and we're going to talk about menopause because, frankly, it's something that most people aren't talking about.
At all.
And why is that?
Well, I think that hormones got kind of a bad rap with the Women's Health Initiative, and now women are enduring it. There's a lot in the literature, not really good or bad, but there's a lot going on with menopause that's fun and exciting.
But yeah, no, it's interesting because I've actually gone through menopause. And my whole life with periods, it was a total nightmare. My hormones were raging and I just felt completely out of balance. But now that I've gone through menopause, finally my body's at peace. And I'm like, feel good and normal for the first time in my life. And I think that people don't realize that some people have a very positive experience.
Yeah, I had no
menopause.
idea. It sounds like something I should be scared of, but you're telling me no.
Yeah,
and I think.
And what is the statistic on that? I mean, are there people that you find that have a positive experience like I have?
Absolutely. Well, it turns out that about 70 to 80% of women will have hot flashes, but many won't. And most of those hot flashes go away within a year or two. 10 to 20% of women will have hot flashes the rest of their life. And the hot flashes are pretty uncomfortable. They cause sleep problems and the emotional ups and downs. And what you may be experiencing now is no hot flashes. You feel better, you're sleeping better, and you're not having the hormone fluctuations that you had with the PMS and the periods. So,
But I think what happens with Charlotte's instance, she has one side of the spectrum, the other side is the young woman, right? Because people still think that menopause is an old lady, quote unquote, concern. But how early can you start menopause?
well, that's a great question. You know, now that we have smoking decreases the time you're going to go through menopause. So the average age is 51. Now we might see women in their 40s going through menopause.
gosh.
And then we have this thing called premature ovarian failure, where the ovaries just give out. And in your, late teens, early 20s or 30s, you just stop having periods and start having hot flashes, and that's pretty overwhelming.
So when you get, when you talk about premature menopause, is that, I mean, you're probably not getting the positive effects like Charlotte did. Is that something that is a little bit more critical?
Yes, because you're so young, and that's a time when you're thinking, oh, I'm going to have children. Most women say, oh, I'll have kids by the time I'm 40. And then all of a sudden you're dealing with, oh, I'm not going to be able to have children. All these hot flashes aren't a thyroid problem or...
Can you still do things like egg freezing or anything like that when you go through menopause?
Well, you can beforehand. So the good time to do it is before you're 40. That's in a woman who is going to go through the menopause at 50.
But go ahead.
I'm sorry.
But you know what, Dr. Thomas, to your point, our producer, she was starting menopause at age 32. And the problem was she was misdiagnosed. So can you, she went to the doctor and they were telling her it was everything but because of her age. So how do you as a woman keep pushing your doctor to say, hey, there's something different about that? What conversation should we be having?
I always say if you're seeing a doctor and what they tell you doesn't make sense, just find another doctor. I mean, really, because
so important.
if you're having hot flashes, sure we want to check your thyroid, sure we want to check some other things. But in a woman, hot flashes a lot of times is menopause, whether you're just starting your period or you're finishing your period, especially with...
How long do the hot flashes last? I mean, is it just a flash or is it something that's... I have no idea.
It's called a personal summer.
I have hot flashes. I mean, I don't now, but I had them for like a year or two. But to me, they aren't that big of a deal compared to what I went through when I was having periods. But it's just you get hot for a little bit and then you get cooler and you just have to keep taking your sweater off and on, or you have to take your blanket off the bed and then back on all night long. That's all it is. I don't think it's that big of a deal, frankly.
Well, some women become drenched and actually change their clothing 10, 20 times a day because they are so drenched. And those women also have hot flashes for, 10 to 20% of them for the rest of their life. And they do stay on long-term estrogen as a result because that's the best way to treat it.
Are there certain foods that help you with this transition?
Yes, well, it turns out avoiding alcohol, dressing lightly, taking a cool shower, swimming at night helps reduce it. Staying away from a lot of hot, spicy foods. I mean, you'll determine as you eat something, go, whoa, that really caused a hot flash.
What about food like soy? I mean, because it's high in estrogen and it's so prevalent these days.
Soy is a good food, but I wouldn't recommend it as a supplement.
Well, Dr. Thomas, that was such a great conversation that we have, and we're just going to have to bring you back for more because we have so many more questions. So thank you.
Well, thank you. I look forward to coming back.
All right, great. And you'll want to come back to Every Way Woman when we come back.